And this meeting is being recorded. I'm sorry, I'm just trying to figure things out myself here. So what, oh, it looks like our videos are working again. Great. That makes it so much more fun. Hello, everybody. Thank you so much for being here. I'm Liz Grassi with the Strategic Growth Council, and I thought that this morning, before we get started, we could just do quick introductions so everyone knows who's in the room. So with that, I will hand it off to my colleagues at SGC. Leah.
Hi, this is Leah Fisher. I manage the climate change research program with Liz. I think I know all of you, and this is the third presentation from this team, so very excited to hear it. Fabiha, you want to go ahead?
Yeah, sure. Hi, everyone. My name is Fabiha. I am the special assistant at the California Strategic Growth Council, and I am very excited to hear the final installment of this presentation. I'm looking for any other, I'll pass it off to Nicole.
Hi, everyone. I'm Nicole. I'm the CCST Science Fellow at SGC supporting the CCR team.
Great. And then maybe we could go over to the rest of our group over at OPR. Juliet, do you want to introduce yourself?
Sure. I'm Juliet Hart, and I am the program manager for the Integrated Climate Adaptation Resiliency Program, and I will send it over to Nuantara.
Hi all, great to see everybody. I'm Nuantara Key, Deputy Director for Climate Resilience at OPR. Really excited to hear the presentation here today. I'm going to hand it over to Lisa.
Great, thanks. Hi, everybody. Lisa Hu, she, her, hers, Associate Planner of Climate Equity and Resilience at OPR. I'm leading on our Vulnerable Communities platform. Excited to be here. I'll pass to Chino.
Hey everyone, my name is Chino Solozonia. I also go by Chino. I'm a OPR summer intern working with Lisa on the Vulnerable Communities platform. And I'll pass it over to Jason.
Hey all, sorry I'm late. My name's Jason Vargo. I'm with the California Department of Public Health, and I'm the lead scientist there in the Climate Change and Health Equity section.
Great, thank you. And then I think from OPR, Taylor, did you introduce yourself?
No, I did not. Hi, everyone. My name is Taylor Carnevale. I go by she, her, hers pronouns. I'm an executive fellow with OPR's climate team.
Great, thank you. And then we have Amanda Hansen over at Resources.
Hi, everyone. Amanda Hansen from Resources. I'm the Deputy Secretary for Climate Change. I'm really excited to join you. Thanks.
And Jose Lopez at CARB.
Yes, hi, good afternoon. My name is Jose Lopez, Air Pollution Specialist over at CARB in the Research Division. I'm looking forward to the presentation.
Great, thank you. I think that's everybody from the state side. Did I forget anybody before I turn it over to JR and Lolly to introduce themselves? Is that all of us? Great.
And hey, Liz, before we do that, I was hoping Amanda or Nuantara could give a little bit of context, like, you know, very briefly on the extreme heat framework. I thought it might be useful for UCLA to hear before they start.
Great.
Sure. Maybe I'll kick off, and Nuantara, you can fill in where I forget something. But I think, you know, as we work to update the state's adaptation strategy this year, which we do every 3 years, we're recognizing that there is a gap in our approach to address extreme heat, mostly because we've not updated you know, the vision that we have for how we can collectively solve this problem. The last time that was done formally, it was 2013. So the time has come, and obviously, you know, it's an issue that we are hearing more and more and more about. And so I think, you know, from our perspective, this is a really exciting space to be driving on, just because it's there's such an important need, and people understand it, and I think there's a lot that we can do to help sort of push the agenda forward. I don't know, Nuantara, if you want to, what did I miss or mischaracterize?
No mischaracterization at all. Yeah, I I don't have much to add besides really just trying to think about how to, echoing Amanda's point around, having a consistent framework and really recognizing kind of the interdisciplinary approach that is needed on addressing heat. So really looking forward to this presentation today to help jumpstart our thinking on, kind of where we're going and where we've got action, and then where there are gaps that we can fill. So appreciate the conversation. And I think Liz Clessy joined after we did intros. So
great. Perfect time for her to introduce herself.
Hi, sorry. I needed to grab a quick bite to eat. My name's Clessy. I work with Amanda at the Natural Resources Agency. Excited to hear these presentations. Thanks.
Thank you. Okay, so before I turn it over, Leah, is there anything else that I need, any housekeeping that we should get done before we turn it over to the UCLA team?
I don't think so. Other than, we encourage a lot of dialogue, and you can log your questions in chat if you'd like. JR and team are going.
Great. Great. And we really appreciate JR and his team taking all this time to really help inform us about the important work that they're doing. He works on so many of our projects. It just happens if we're doing good climate work, JR is somehow involved. So we appreciate your time and talent, JR, and I will turn it over to you.
All right, thank you so much. So those of you who don't know me, I'm JR DeShazo. I'm the director of UCLA's Luskin Center for Innovation. And Lolly, would you like to introduce yourself?
Sure. Hi, everyone. My name is Lolly Lim. I'm a staff member at the Luskin Center for Innovation, working with JR on these various projects. Nice to see some of you again.
Yes. Thank you, Lolly. So there are two of us from UCLA today. Over the last two sessions, I think you've heard now from a total of maybe 8 of us. This is a really wonderful multi-themed research project that started out with reference to this slide, focusing on impacts and trying to enhance our understanding of the impacts of climate impact in the form of extreme heat. And we heard earlier this week from Ji-Sung Park, who talked about the way in which worker injuries and fatalities attributable to heat have been systematically underreported, and the need for greater focus on both outdoor and indoor heat risk prevention. Alan Bareka talked about heat exposure and childbirth outcomes and the way that it affects pregnant women. We had CJ Gaby and Greg Pierce and Ji-Sung and Nora Pankratz also talking about the impacts of extreme heat on energy use, energy burden or debt, and disconnection risks in the context of trying to cool low-income households' homes. And also a big and important vulnerable element there is subsidized or manufactured housing because of the relatively low quality of the house, the thermal performance of that housing. And Professor Gabe and Pierce talked a lot about the different types of vulnerabilities that are occurring there. And so really the first two sessions talked a lot about impacts and vulnerability. And we wanted to wrap up in this third session by asking how well prepared are we to govern extreme heat exposure? And that's going to allow us to present to you some research that we're almost finished with, which sort of assesses at the state agency level how prepared we are as a state to identify and develop policies and implement policies and funding that help us manage heat risks in different exposure settings. And I'm going to talk a lot about the need for exposure setting specific approaches. And as part of that, an analytical capability that we felt like we needed, Lali's going to talk about the Healthy Places Index, the Extreme Heat Edition, and sort of describe how that adds to the repertoire of other existing spatial tools. So Lali, why don't we go to the next slide? So I'm about to hand it over to Lali, who's going to talk about the Empower evaluation, which was our community engagement piece of this project. And then I'm going to talk about the policy gap analysis that we've done. And then Lali's going to close things out by introducing the Healthy Places Index Extreme Heat Edition. And I should say, I think the Healthy Places Index, they're hoping to develop additions for all the major climate impacts. So I think that's the vision there. So Lali, why don't I turn over the floor to you?
Sure, thanks, JR. So this is a piece of the project that we worked on as part of this SGC grant that is not explicitly related to addressing heat impacts, but is focused on understanding how best to deliver existing programs to communities in need, which obviously ties into delivering all sorts of types of resources, including heat resilience and adaptation building resources that could be considered as for this type of work. And so just to quickly describe what this pilot program was, this was a countywide campaign that was led by a foundation called Liberty Hill, which funded 8 different grassroots community-based organizations to connect low-income residents to a suite of different programs. It was around 50 different programs offered in the LA area, focused on clean energy, transportation, bill pay assistance, et cetera. And the idea behind this program was that it's critical to ensure that these resources that exist are reaching low-income communities that they're designed to serve, particularly given what we know about the kind of affordability or the, what do you call it? The larger affordability burdens that are borne by low-income households who pay disproportionately higher parts of their income on utility costs, and also based on studies that show that without a targeted delivery method, as well as assistance in participating in some of these programs, they just don't reach their intended audiences. So the pilot of this Empower pilot was focused on providing funding directly to community-based organizations that could then take a bundle of these programs and deliver them directly to the communities that they are embedded in. And so, so this particular pilot started in 2019 and is still running today in a reduced capacity. And as I noted, it's about 50 different programs that these community-based organizations took, and they each took different approaches to delivering these programs using door-to-door methods, tabling, et cetera. And all of the interactions that each CBO had with residents were recorded in a platform called Salesforce. And the role that UCLA played in this, and I should have started out by noting that the analysis was primarily conducted by Dr. Greg Pierce and Rachel Connolly, who's a staff person affiliated with this project. They couldn't present on this today, so I'm relaying their work. But the role that UCLA played with this effort is in evaluating the data that was collected on Salesforce about how the level of reach that this pilot had, as well as who was reached, and as well as some conversations with these CBOs about the processes and how this effort proceeded. So some of the key findings were that this CBO-led outreach was highly successful in reaching some of the most environmentally disadvantaged and impoverished communities in LA County. Within 1 year's time in 2019, these 8 CBOs were able to reach 11,000 distinct households and received over 2,700 eligibility applications. And it was found that 92% of the participants that filled out these eligibility applications either live in a Cal Fire Screen disadvantaged community or is classified as a low income within a low income community. And among the population that was reached, the median income there was 23,000 per household, which is considerably lower than the statewide and county median. So the results of the data that was collected showed that the program was really successful in reaching some of these often hard to reach population groups through these concerted efforts through the CBO method of delivery. And another piece that the analysis worked on was understanding the realizable benefits of these participants in utilizing some of these programs. So we weren't able to understand the direct impact in terms of actual program uptake, as that takes some time and to actually calculate the amount of dollar savings that were incurred after participation. But we were able to estimate by asking if a subset of the households that participated in this intake work did indeed sign up for a small subset of the programs that were offered. And the estimates that were used were a third of the eligible individuals signed up for, I think it was 5 of the programs, that over $1 million in benefits could be distributed to county residents in need. And if some of these participants signed up for some of the one-time incentive programs, including some clean vehicle rebates, there are approximately $4.2 million in benefits that could be distributed to these households. So based on some of these findings about the capacity and successes of this type of pilot effort in working directly with community-based organizations to funnel resources to those organizations to then reach out to their communities. This model has been expanded and is currently being used in the San Joaquin Valley, adjacent to LA proper. And there are currently some plans, some discussions happening with the utility Southern California Edison to expand this type of CBO led program delivery into the Inland Empire. And the Empower program is still currently going, but just in a reduced capacity, kind of coming out of COVID and coming out of some of the reduced funding that the program is dealing with now after the initial pilot phase. So that was a quick run through of this effort, but I think the goal is that this type of model can ideally be scaled into other areas and adapted to be relevant to different communities and community-based organizations. If there are any questions, I'm happy to take them, and also happy to connect you directly with the 2 lead researchers who worked on this analysis.
Thank you, Lolly. Are there any questions for Lolly? Okay. Hearing none. Lolly, why don't we advance the slides? So I'd like now to turn to our policy gap analysis. And this is going to be a review of state level policies, funding opportunities, and sort of gaps in high priority settings. And I want to just set the stage for this analysis. I think everyone on this call knows that California is going to see an increasing number of extreme heat days and more intense and longer heat waves in the coming decade. And that the impacts of this extreme heat are really going to be felt across numerous sectors. You know, they're going to affect our education system, our healthcare system, our worker safety regulation context, water infrastructure, our energy supply system. It's my professional opinion that of all the climate impacts, extreme heat is probably going to be the most costly and geographically pervasive impact that California is going to have to deal with over the next century or two. And those
JR,
impacts, yes.
I'm going to interrupt you. I'm so sorry, but I'm very curious. When you say costly, do you mean, is that directly because it's going to be experienced because it's going to be experienced across the state, or is it in addition to that other factors that make it more costly than other, like wildfire, other threats? Or you don't know, that's fine. I was just curious. I immediately wondered.
Yeah, it's the number of people who will be impacted through multiple pathways that I think will make it costly. You know, one of the things, and I basically, I think where we are is there is a blossoming of research that is beginning to describe the health cost, the financial cost, both privately born and publicly born, of extreme heat exposure. Children learn less well, workers are more prone to have accidents. There are numerous health impacts, lots of infrastructure impacts. And so we're at a moment where heat exposure as a environmental externality, as a hazard, is finally on the radar screen. And we're sort of midway through figuring out, like we used to have to do for air pollution, what the social costs are. And so I think one way to think about it is, we have the social cost of air pollution frameworks that we use. I think air pollution is more harmful than extreme heat, but extreme heat among the climate impacts, I think, is going to be the most socially costly, at least for California.
That is helpful. Thank you.
And I think there needs to be more research on that, but that's a lot of the work that SGC funded us to do begins to lay the groundwork for those estimates. And so, that might be a natural next step. And I think, Amanda, to the underlying, focus of your question, it's really important to recognize that extreme heat is going to affect different segments of the population. It's going to affect mothers, seniors, workers in certain climate exposed sectors. It's going to affect low-income households who live in vulnerable housing, school children, people in transit via transportation, park users. There are a lot of settings, exposure settings, and a lot of vulnerable populations where we have to look at the intersection. And so let's go to the next slide, because we tried to do that in this analysis. So the motivating question the broad question that we're trying to answer is the state of California prepared to govern extreme heat risk? And, and that can be broken down into a variety of questions. And I love your feedback. And I'm so happy that, we have so many folks from OPR and from other state agencies who have been part of this series. Because as a public research university, really want to produce research and work that supports your goals and your mission and your objectives. And so one of the questions we're asking is, how well developed and comprehensive or complete is the state's policy framework for heat risk management? Does it have the capacity to undertake research for exposure settings that are priorities, develop and then communicate exposure metrics, guidelines, and then standards? for the relevant state agencies for the exposure settings that each state agency is responsible for. So you'll see in just a minute, we do this mapping between critical exposure settings like the people's homes or their workplaces and the agencies that currently through their programs could affect investments in heat resiliency in those exposure settings. And so I'm not quite done there, Lolly, sorry. A very natural question to then ask, number 3, is do these state agency programs recognize heat as a hazard, number 1, and then appropriately integrate it into how they allocate resources to manage the risks when implementing their programs. And then looking across the exposure settings that are priorities, and I'm going to introduce those in just a second, are there significant governance or policy gaps across those exposure settings? Right. So this is sort of broadly speaking, the set of questions we're trying to take a very preliminary first pass at. And let me just, before we get into the details, let me just say, these policy goals could be trying to mitigate heat by reducing urban heat island effects or other localized heat production or heat retention. But more likely, they're also, number 2, going to be trying to protect or reduce the exposure of extreme heat to vulnerable populations, right? So there's both a mitigation objective and a protective or preventative exposure objective that the policies might implement. And then, we're going to talk about this, but policies that deal with environmental health hazards like this, they can take a lot of forms. Emergency readiness, information, guidelines on what's healthy and what's not in terms of threshold exposures for different periods of time, standards that are mandatory with respect to different exposure settings that basically say, there's a responsible party who cannot let the temperature exceed X degrees for a certain period of time, or that there have to be best available technologies there that, are sort of the best we can do to kind of mitigate heat. So there's this whole toolkit of policy strategies that are available that when we look at other environmental health hazards, see employed all the time. And part of what we're beginning to do is think about, well, what does that toolkit look like for extreme heat in this context? So let's go to the next slide. So when we started thinking about this question of regulating extreme heat, one important question became, well, we need to think about where people are going to be exposed to extreme heat. And we need to identify priority exposure settings and then further look at the vulnerable populations that would occupy those settings, almost by time of day, and maybe even seasonally, to begin to think about what are the priorities and what are the priority settings in which we might want to further develop policy to deal with heat risk. And so one of the things that we did was we looked at the time of basically time surveys to look at where do people spend most of their time. And basically the top 3 destinations or the top 3 places, top 3 settings are your home. By far, the home is the most important, and of course, it varies by population characteristic. The workplace, for certain populations, schools would be number 2. Workplace would be number 2 for other populations, and then transit is also quite important. And then the heat vulnerable populations that we really focus on in this analysis are seniors or older adults, youth and infants, environmentally exposed workers. So this is going to be climate exposed industries, low-income individuals, incarcerated and unhoused individuals, pregnant mothers, and people with disabilities and pre-existing health conditions. So those are the vulnerable populations that we're thinking about. We're not going to look at each of these in great detail for each exposure setting, but some of the exposure settings naturally focus on some of these subpopulations. So let's go to the next slide. So these are the priority exposure settings: homes, workplaces, schools and daycare centers, prisons and correctional facilities, senior assisted living facilities. And then there's a variety of community scale exposure settings like public transit stops and sidewalks, parks and recreational spaces. And so we organize our report really around each of these settings. And for each of these settings, let's go to the next slide, we ask a series of questions. What are the heat relevant laws and regulations that currently exist for this setting? And the way that we're going to answer that question is looking at existing laws, codes, regulations, and things like that. Number two, what are the possible heat risk reducing interventions that are unique or important to that exposure setting? One of the challenges so far is that a lot of the intervention literature is very generic. It's not setting specific. And so when we're thinking about what priority interventions are, we need to really think about, well, what are the priority interventions for this specific context or setting? And then importantly, what are the state entities that have oversight over that specific setting? And so actually, Lali, why don't we, I think I expand on this. Yeah, so for the interventions, you can see just some of the examples of the interventions here. And then which state entities have oversight? Let's go to the next slide. Okay, so we kind of skipped that one. I'm going to spend a lot of time later on talking about state agencies. So it's going you'll see the sort of the approach to that is to really look at which state agencies are relevant in the different exposure settings that I listed up there before. And then what are the state level funding opportunities that for implementing heat risk reducing interventions? Right? So for every exposure setting that we presented, we're going to answer these 4 questions. Okay, and we've done that already. We can share that with you whenever you're interested, and we'll have the full report out in probably a week or 2. Let's go to the next slide. So I want to give you just an example because I think we have a total of 7 or 8 settings, and so I can't go through all of them in a 15-minute presentation. So the most important one is probably the residential setting. And it's also maybe the most challenging in some respects. And you know what we do is we ask: is there a temperature or heat exposure standard? Is there a clearly defined responsible regulatory agency for heat exposure as a health hazard? And is there any monitoring, or is the standard enforced in any way, right? And so one of the interesting things that you discover when you dive into this is building codes aren't required to be protective with respect to high temperatures. In contrast, you know, cold temperatures do show up in building codes. And so, you know, what we do is for each of these, we kind of go through this and we know there's no statewide requirement for maintaining indoor temperatures at sufficiently cool levels. In contrast, there are heating requirements. Air conditioning is not required. It's not a required provision. And then you look at, well, what are the voluntary or exemplary, you know, provisions like the Cal Green Code? It does include a mandatory measure for cool roofs, but only for new construction, and that's voluntary. And in terms of state level funding opportunities, there are a wide range of programs that support weatherization, cool roofs, solar PV, which also has a thermal protective element to it, bill pay assistance. And so there are going to be programs that address the impacts of heat, and I'll talk more about that in just a second. So let's move on. So, you know, this is an example. We're going to look at the laws and regulations for the residential setting. Lali, let's move on. And then we look at the interventions that are available within the residential environment. And of course, as soon as you're in the residential environment, there is owner-occupied properties and there are renter-occupied properties, right? And And there's a lot of discussion that needs to happen around the regulatory strategies for those two, because they're very different. But what we do in the report is we go through each intervention, we identify the state agency that can influence them, and then we identify the state funding opportunities and programs. And we do this for every intervention that's available for within each setting, and then across all the settings that we consider. All right, let's move on. So if we, I want to sort of now move towards, I'm not going to go through the other 7 settings, exposure settings. We can talk about those later if you're interested. But I wanted to give you just a sense of what our findings are going to look like. So one of the questions is, where are there heat relevant regulations? And we really found that there are 3 areas where those regulations currently exist. One is the workplace. So Cal OSHA has an outdoor heat illness prevention standard, and they have an indoor heat illness prevention standard that is underway and in draft form. Daycare centers and senior assisted living facilities also have actual heat exposure standards. So they have a range of temperature that's considered acceptable. And the Department of Social Services and Community Care Licensing Division oversees those heat standards. And there's an inspection form. Actually, Lolly, can we stay there for a second? It's part of the inspection checklist for those facilities. And then we identify the areas in gray, the residential, the schools, the prisons, the public transit stops, and other public spaces where there are no either guidelines or standards for heat exposure, right? And for some of these, you could think, well, like outdoor spaces, how could there be a heat standard? What you might have is best available technologies, because who can actually, fully regulate heat exposure in some of these environments? And that's where we really have to think creatively about this environmental health hazard, because we're going to have different policy approaches in different exposure settings, right? Some of them are going to be regulated through standards. Some of them are going to be approached through best available technologies and investment opportunities to make those technologies viable for low-income communities. Let's move to the next slide. So one of the things that I said we do, and I'm going to just show you this to you, is we look carefully at the funding opportunities for extreme heat risk management. And for each opportunity, we try and identify the following, which heat relevant measures or offerings are available, what's the role of heat adaptation and mitigation within the program objectives. So how seriously is heat considered? Is it actually a basis for making funding decisions? And what are the heat considerations in terms of program eligibility? So in other words, one of the challenges, and this is, I'll just say this right up front, Cal EnviroScreen does not consider heat. It doesn't consider any climate risk impact, in fact, right? Or any climate hazards, but it certainly doesn't consider heat. And there's no reason to expect that it would be a good guide for where to make heat resilient investments. And even AB 1550, which is the other screen, is going to perform really poorly as well in terms of the correlation. So that's one of the reasons that we need better heat spatial analytical tools, so that we can begin to, do a Cal EnviroScreen type analysis for heat exposure. So let's move down to the next slide. So I'm just going to give you some examples.
Can I just quick, and I'll put this on the table and we can come back to it later, but I don't want to forget while we were on that
Sure.
slide into your last point, just fully recognizing that we as a state, to enable consistency, but also to make sure communities have the information at hand to respond to the right policy question in the right way. We are building, and Lisa, who is on the line here, is the lead on our staff for this effort, but we are working to build a vulnerable communities platform that would get at what you just described around heat, but we're working to build that out for all climate impacts. So we actually have the right information in the right tool for the right policy questions, because their Callan virus screen is a very important role for a set of policy questions, but it was never intended to be kind of the catch-all for all climate related investments or policy decisions. So just a flag that, agree 100% on the need for that. And we're actually trying to build that out now. So this is also incredibly insightful and helpful as we're building out that decision support tool.
So it sounds like we're saying the same thing and have a sort of, you're trying to actually provide some solutions there, which is awesome. So, we reviewed funding opportunities. I just wanted you to see, this is a list for households. Let's move to the next slide. Also households have a large workplaces, many fewer investment opportunities for employers. For schools, there are a few intervention programs. And then for local governments and outdoor spaces, for those exposure settings, there also are some programs. The fact that there's a program that could be relevant is going to beg the question, how well does that program recognize differences in heat risk exposure across the state, right? And does it use that information in thinking about who to give more or fewer funds or support to? And we're going to find that most programs don't do that. And then we have, there's local planning, open space, local planning, transit, and then local government planning grants, right? So there are a lot of local government oriented programs. Again, what we're going to find is they're largely unaware and not responsive to heat risk and not focused in any kind of quantitative or substantive way in terms of using heat risk estimates as a criteria for allocating funding, right? So there's the good news is there's an opportunity there, right? And there's a lot of frameworks there. So just some broad findings. There's no statewide heat exposure standard or regulations for key indoor settings, specifically residential settings. And of course, I think the one we're going to be most concerned about are rental residential environments. Schools, prisons, jails, correctional facilities. There are existing rules for assisted living facilities, daycare centers, and places for outdoor employment. Whether those existing regulations are appropriate is an interesting question, right? And one of the things I would like to have done is sort of do a little bit of a deep dive into the history of how those rules were developed, right? If we were going to do this really carefully. There are currently no statewide requirements to consider or improve the thermal comfort for selected public outdoor settings, especially transit stops and shade for public parks. And then when we get to reducing the urban heat island effect, it's interesting because I feel like that has taken on kind of a life of its own. And there has been some attention paid to the urban heat island effect. But one of the things that we found is, there's a bigger dynamic here associated with heat exposure, of which the urban heat island effect is just a multiplier. It's just an amplifier. And the broader climatic trends are really producing the heat exposures that need protection. And so, while I would never say urban heat island effects and mitigating them aren't important, even if you address those and made urban environments comparable to rural environments, you're still going to have extended heat waves and extended heat extreme exposure because of climate change that we need to become more resilient to, right? So these other exposure settings can be benefited by reducing urban heat island effects, but that's only part of the story and part of the solution. Okay, let's move to the next slide. So, and then when we look at this, we identified over 20 programs that they offer interventions that could be relevant. But most programs don't identify or address heat as a primary objective. So there are a lot of programs out there. Most of them don't recognize heat as an important environmental health hazard, and they don't allocate funds with regard to it. And one of the things that we're trying to do in this analysis is take a first pass at asking the question, all right, 20 is a lot. There are even more than, now it's a lot of programs. Which exposure settings are most important, right? Which of these 20 would you prioritize reform of, right? And we're trying to sort of move towards that. And so the other thing that we find is that most existing state programs don't make investments that intentionally target heat vulnerable places or heat vulnerable communities, or quantify heat risk reduction benefits. I mean, if you compare GHG emissions and the metrics that we use now around the California Climate Investment Fund, and you were to develop something similar for heat exposure, you would see the gap between how seriously we take GHG emissions. We have all of these performance metrics, all of these tests that have to be used for investment eligibility. We don't have anything like that for extreme heat exposure. So I'm not gonna, let's go to the next slide. And then I think, one of the challenges that I think exist is that there are probably 8 to 12 state agencies. It would be, I think, helpful that administer programs that are likely to be really important to managing heat risk in the future for different populations in different exposure settings. It would be really nice if every agency didn't have to develop its own internal research capacity to identify what the relevant heat exposure thresholds are for the exposure settings that it's responsible for. I think that there's a benefit to centralizing that. And for some of these agencies, they're not in the business of knowing environmental health and epidemiology and physiology and things like that. And so if we expect heat risk regulations to kind of effectively propagate through across these different state agencies, most of whom have missions that have nothing to do directly with environmental health per se, or if they do, it's only indirect, we're going to need to provide assistance to those agencies. All right, next slide. So, what do we find? We conclude by saying there are some limited protective measures in place. There's no centralized kind of resource for sister agencies that's producing kind of guidelines for these different exposure settings, and the basic environmental health expertise that would be needed to do that is pretty common across all those settings. I mean, the settings are different. The vulnerable populations might be slightly different, but the expertise that's needed is going to be pretty common. And then when we get to future standard setting, the articulation of best available technologies, whether it's materials or shade structures or other things, when we think about state programs that offer actual funding or investment opportunities, we really don't see state agencies broadly having that capacity, although they have programs that could significantly assist in managing heat risk exposure. So I'll stop there. And I'm going to apologize and invite questions now, because I'm actually just a little after 1 o'clock. I'm going to have to, about 10 minutes after, I'm going to have to slip out.
Well, I have a question, but I really want to defer to my colleagues at OPR and SGC. So maybe if you guys want to ask, but then give me a sec at the very end.
Well, I was just going to say a thank you very much for this. And I think there's a lot of alignment and really interesting things that you've framed out here that definitely align with many of the conversations we've had. So I just would offer that, but Amanda, why don't you jump in and then we'll just, go with questions from there.
Okay, so here's my question. I think it's the question on governance that you guys tackled. And the question is, like, if you had a centralized authority to address every, intersectional risk that we deal with at the state level across like all of the efforts, right? Like, let's just think beyond climate. Like, that doesn't work. So I'm just curious, like,
yeah.
Is there, what other options did you explore, and why did you land here?
So Amanda, when there's so many different capacities that an agency could have to address different climate risk. And I think I agree with you that what we didn't want to do was to say that we didn't want to say there needs to be a centralized agency for standard setting or for issuing best available technology guidelines. It seems like, Caltrans and transportation departments really probably are in the best position to design bus stops, but they need probably more technical support to think about where to prioritize that, because they need to be able to look forward and they need to know what ambient temperatures are. I mean, the other thing we don't talk about here is distributed sensors and measuring temperature, right? That's really going to be, I think, the next set of research that's needed is to actually look at temperature variability, and there is modeling that does that. What I was trying to say is that on the public health side of this question, it's a very, what should the human body be exposed to when engaged in certain activities, learning, working, sleeping, walking, what temperatures you can be exposed to and not experience discomfort or impairment or ill health is those are different thresholds in terms of capacities, and heat exposure impairs all of them at some temperature. And so what I was suggesting is you could think about it as an environmental health task force that looks at different exposure settings and provides guidelines on thresholds that, I mean, again, if you look at the Cal OSHA indoor draft rule, you begin to see the variability that's associated with, well, if they're wearing certain kinds of clothing, the threshold is one level, but if they're wearing normal clothing, it's another, right? And so the activities that you're engaged in do matter to what these thresholds are. And all I'm suggesting is a lot like NHTSA sets up standards, and within NIOSH, within OSHA does some research. I'm not saying any of these work well, but the idea is that you try and there could be economies of scale and technical assistance that's provided for certain things. And then other things like funding and standard setting and the requirements for best available technologies, I think once the agency has that information on threshold exposures and sort of guidance on that, then they can think about, well, what are the interventions in our exposure settings, our context that make the most sense? How do we phase them in? And things like that. I don't know, did I answer any part of your question?
Yes, although I continue to sort of poke holes because I think, there are a lot of other elements that I think, you could argue require that same level of authority in sort of guidance that will then be taken up by a lot of other entities that have a part but aren't like the central piece, right?
Yes.
And like that's our governance challenge. And it is a real challenge. But I think, that's why I wanted to ask this is, and I hear basically what I'm trying to drive at, I think is probably where you're going, which is, you've got to let entities that are the experts on the thing have the ability to like be the experts, and then everybody else picks it up and applies it in their sector, in their whatever. But there is not one expert.
Right.
on this or other issues. And that's where I get tripped up on the idea of like a centralized authority, because there's literally not one entity that could do that.
Well, and the question is, what is it the authority to do? Is it, what I'm suggesting is that a heat risk health task force that issues exposure setting specific guidelines that might even be further refined by the activities that are undertaken in each of those settings is helpful. Because right now, we don't have any scientifically supported guidelines outside of what Cal OSHA has done.
Well, what the words that you're using are much more aligned with the way that I think, at least think about this, because it's versus saying a centralized authority to oversee the state's efforts and investments. That's like completely different.
I agree with you on that. I don't think, but I do think we need to have the ability at the state level to ask the question, is heat more, where's the damage how large is the health and other damage that is going to occur in the occupational setting, in the residential setting, so that we can think about prioritizing our approaches to those settings, right? And so I agree with you, and I feel like we should have a much longer conversation, because I've been grappling with this too. And you do see there are other examples in the environmental health regulatory world of this problem. There are other examples of it, and I'd be happy to talk at length with you about this.
Cool. Well, I would love that, and we're tackling it and thinking a lot about it. So I would appreciate the thought partnership.
Yeah. Jason, I think your hand is up.
Yeah, thanks for the presentation. A lot of thoughts. A couple that come to mind. I think heat can be like a real sort of example for a lot of other climate-related exposures. And I don't know that if we need to spend so much time quantifying the exposure, but I think we can instead investigate the outcomes and understand some of the upstream drivers that lead to those outcomes, given the same sort of exposures, or or that lead to those outcomes. So or the index can capture the exposure. So one thing that we're doing, and that could be maybe the centralized part of this, is that given a common metric, an index like Cal Screen or Healthy Places Index, that really sort of takes a step back from the, to use Amanda's language, like the experts of the different agencies. Like one agency is going to want to focus on the occupational setting. Another agency is going to want to focus on the land cover. Another agency is going to want to focus on the healthcare delivery. But taking a step back to those indices that really help like describe like structural disinvestment and things like that can really help give like a common language for all of these agencies to speak and to measure progress by. And so that's what we're seeing, at least with our application of the Healthy Places Index in COVID, is that we can use it to talk about how schools are reopening. We can use it to talk about how vaccines are distributed. We can use it to talk about how a county's doing in terms of whether or not it's ready to open up and to ease economic restrictions. And I think there's a common model that could be used for a lot of climate related infrastructure. So when we lay out best practices, for example, we can say these are the best practices that should be going into place, and then use these indices to sort of evaluate who's able to sort of take advantage of those opportunities. Because what I would predict that we see is that many of the places that fall on the lower end of these indices, like the lower end of the Healthy Places Index or higher end of Cal Screen, which have fewer opportunities for living healthy lives, are going to be the places that have a harder time taking advantage of like implementing these best practices as well, that are health protective. And so, yeah, I'd just like to help think about that a little bit. And even though I'm probably like one of the biggest proponents for the Healthy Places Index, I'm not sure that when you look at like the emergency department visits related to heat, for example, that you're going to get a lot of value by examining them through the Healthy Places Index versus the Cal screen, because the upstream drivers that really contribute to people experiencing heat and then ending up in the hospital are sort of like represented in similar ways in both the indexes. And once you get up to the actual index value, there probably are like edge cases, obviously, but I don't, so that's one thing about the Cal screen, I would say. And certainly just this all of government, like health and all policies approach to getting all of people on the same page, like the health and all policies team and the SGC could probably be really influential at sort of helping make that happen. So that's good that we're talking to the right people, I guess.
Yeah, so you said a lot there, Jason. I think, I don't think, Cal screen has air pollution and some local hazardous waste exposure elements in it. It doesn't have heat, it doesn't have flooding, it doesn't have any of the climate risks in it. And so and the other thing that makes it very limited is if you look at where it's going to get hotter, it's typically not in, and it's because LA County has so many of the disadvantaged community designations. It's, there's maybe 40 to 55% overlap there in a population weighted way. And the other thing is we are, you said something about looking at outcomes. And I think the problem is, for example, the work that was done on workplace safety, what Ji-Sung and Nora found were that falls and getting your hand stuck and tripping and falling off ladders, non-heat related injuries, almost double in high temperatures and aren't classified as heat related, while in fact, they almost certainly are, because people are more tired, they're less attentive, there's less coordination. And so there are a lot of outcomes that are misclassified. So there's a lot to think about here, I think. I'm really happy that you all are so focused on this conversation. And if there's any way we can help, we'd love to do that.
That reminded me of one other thing is that, well, we have looked at some emergency department visits and tried to describe like what are heat attributable and how those differ by HPI quartile, for example. We can look at all emergency department visits, or those that are heat sensitive, or those that are related to mental health. But we do see that gradient from the low HPI to the high HPI, more emergency department visits occurring among those least advantaged Californians. So the point, I think the point about like quantifying the outcomes is important, because if we do want to sort of go down that path where we can put the lens of equity onto where the technical assistance and where the investment is going, and say like, oh, each quartile of the HPI across the state received the same amount of money. We can, if we quantify the outcomes, then we could see maybe how much more money needs to go to that first quartile. And that's kind of how we informed the COVID response. We saw 40% of the burden from COVID going into that bottom quartile. And then you saw the vaccination allocation sort of match up with that. So the doubling of the allocation to that bottom quartile. So the quantification, I think, can be important, sort of like assigning a number. Otherwise, the default is like everybody gets the same, and we know that's not good enough.
Yeah, it's almost a question of, do you target vulnerability broadly defined? I mean, I wouldn't even use the HPI index for heat, right? That's why we have a heat addition, because they're not correlated. So do you target the vulnerable populations, or do you target where the hazard exposure is greatest?
I would target the vulnerability. And it goes back to that, like creating that common language, because I think there's more to gain from everybody sort of directing efforts toward the same communities than a specific program like defining their own specific community.
I think if your goal is health enhancement generally, that makes sense. But if you've got a hazard that is very asymmetrically distributed over space, you may need to make resiliency investments in some places more than others, and it may not be necessarily coordinated with, and you know, a big part of this, Jason, too, is that, and we don't really get into this in the report at all, but is who pays for these investments? You know, if you mandate a standard on a private entity, they're going to have to incur the cost of maintaining thermal comfort below a certain threshold. But if it's something that local governments have to do, it's, you know, or it's something that's mandated by the state and there's going to be state complementary investment. So there are these different questions when it comes to heat. When you think about heat related standards, you know, healthcare facilities, daycare facilities, I mean, a lot of the cost of compliance is going to be privately borne and privately financed for certain exposure settings. But then there are going to be others that are much more challenging, you know, like rental units. And so anyway. Well, Lolly, I think, well, let me just say, and maybe Leah and Liz, we would be really happy to have a longer, more leisurely opportunity to talk with Amanda and Nu, Tara, and Jason about this, if because it sounds like you guys are really thinking hard about it, and you know, I've been thinking about it a lot too. And it would be great to just, you know, I'm not sure that we necessarily have any answers, but there are other models for other environmental hazards that might shed some light on how to deal with this.
I, for one, just being for myself, would love to follow on. And I think you all have done so much thinking in this. It would be fantastic to continue a conversation. So I would maybe from our team at OPR too, we can maybe think about who else would maybe want to join, because there's so many tie-ins to the work that we're doing in a number of different places through what you've brought up. So I appreciate it.
Yeah. Okay. So Lolly, why don't I turn it over to you then to talk about the heat tool?
Oh, I'm sorry, I was on mute. Great, thanks, JR. So we'll move on to talking about this tool that we developed in close partnership with the Public Health Alliance, which operates the Healthy Places Index. And what we did here was we worked with PHA to build on the existing platform of the Healthy Places Index, but introduced a couple new indicators related to heat exposure, as well as a couple new features. So I'll walk through this with some examples. So the goal of this effort was to be able to provide users with easy access to data on projected extreme heat days for various geographies throughout the state, including census tracts at the city level, at the county level. Also allow elementary school districts and other geographies, and also to provide data sets that are focused on heat vulnerable populations, as well as community conditions that are relevant for heat vulnerability. And also we included a new feature in here that allows users to identify funding sources to address heat. So the users that we have in mind are pretty diverse. This is a pretty flexible addition to the existing HPI. But we're thinking that this might be useful to local jurisdictions that are working on hazard mitigation planning and want access to some of these heat exposure data sets or information on their communities, or are interested in trying to identify high priority locations for particular interventions. So I'll walk us through an example of just a location that I kind of chose on random, but it's the city of Bakersfield, which is northeast of Los Angeles. And so when we enter this version of the HPI, you can look up the location. So we see Bakersfield, and we see here the data set of days, the projected days above 90 in mid-century, and we have other exposure data sets too. And we can also see where this particular jurisdiction kind of stacks up compared to the county average, as well as where this city kind of ranks compared to all other cities throughout the state. on the Healthy Places Index score. And then once you scroll down, you can see other various heat exposure data sets. We have days above, projected days above 90, above 100, as well as projected extreme heat days compared to historical averages at both the mid-century and end of century timescales, using local downscaled data sets, using the 4 priority models for California from CalAdapt. So jurisdictions can access that information about projected temperatures for their area in the future, and they can also access data sets on existing indices like the Healthy Places Index and CalEnviro Screen 3.0, and where they kind of rank compared to other jurisdictions throughout the state. We have some economic indicators that are listed there. Some environmental indicators that many of these were pre-existing on the Healthy Places Index, and we introduced a couple new indicators too, like some housing indicators. I'm sorry, I guess I don't have them listed, but we also have other housing indicators related to the concentration of mobile homes and RVs and housing before a certain date. So that's all in there. And then we also have a section on population characteristics, focusing on those that are particularly anticipated to be sensitive to heat. So we have information on younger populations, on older adults, broken down by older adults who live below poverty or are living alone, etc. So all of that information is available for jurisdictions that want to access this for their own planning purposes. And there are also features that allow you to visualize any indicator so that you can answer the question of where some of these sensitive populations might be concentrated. So in this example, I use the same jurisdiction of Bakersfield and try to understand, where are the census, based on the census tracts within this jurisdiction, where do we see the highest concentration of older adults in this area? And so we can visualize that and then rank these tracts, and then you see in the middle, the darker purple tract, we see that the population there, over half of that population in that tract is age 65 and older, which when looking at all the census tracts throughout the state is pretty much one of the highest concentrations. It's 99 on the 99.6 percentile. So presumably a local jurisdiction could project data sets of relevance for their interest and identify areas that are high priority for targeted interventions, whether that be direct outreach or encouraging or other messaging in order to prepare for extreme heat events or to implement other type of more long-term interventions. Another example here is the one with mobile homes, which we know are particularly dangerous for heat exposure, just based on the kind of thermal capacity and performance of those settings. And we similarly can see here on this tract that up to close to 15% of the population in this particular larger tract lives in a mobile home in this area. So this can be a way of identifying in a targeted way areas that might need weatherization or other types of assistance in this particular jurisdiction. Um, and then, like I mentioned, we have in this tool a list of different resources building off of the matrix that JR shared, where we looked at these different programs. So we included all of these here, and they're organized by who can access these resources, and also explain what heat mitigation or resilience measure that is being provided by each of these programs. And similarly, this is just an example of another type of geography that this tool can be used for. This is an elementary school district with similar information, and this can also be informative for identifying school districts that are, in terms of their relative ranking of how many extreme heat days above the historical baseline is anticipated in the future. So we see that this particular example of this elementary school district near Visalia, this Stone Coral Elementary School, is apparently ranks the highest in terms of extreme heat days in mid-century. And then I have some examples that go outside of the local level, just kind of zooming out at the state level. Here's an example of workers that experience high, the population of workers that experience high environmental exposure, defined as workers that spend more than half of their time in outside of indoor air-conditioned spaces. This is a data set that we created using ONET, Bureau of Labor Statistics data. So here we see that when we're looking at the county level, in terms of the population of workers that experience this high level of environmental exposure, we see a ranking of these counties, Monterey, Kern, Tulare, of areas that have the highest population of these exposed workers. And another feature of the tool, which is where the kind of intersect between heat projections and vulnerability conditions comes into play, is where we can overlay these data sets. And the way this function works is we are able to select the exposure metric of interest, and as well as the population or community level condition of interest. And what this feature does is it overlaps them, but only the way it works is that the top quartile of each data set is highlighted. So what we see here, previously we saw this map of counties throughout the state with the purple, the deep purple represents the highest quartile of counties that, in terms of the workers experiencing high environmental exposure. And what this does is it takes that data set and then also identifies the counties where that also have the top quartile of anticipated extreme heat days in mid-century. And what we see is where those conditions intersect. So what we see is the highest quartile of anticipated heat and the highest quartile of environmentally exposed workers by county. And then there's some other examples at the census tract level where this feature can also be used. So I think we were talking about CalEnviro screen. So what this shows, maybe I can, So what we see here is just the CALM screen DAX, which are the top quartile of CALM screen census tracts. And this is a community east of LA County. And what we see here is the darker Fontana, San Bernardino. That is where we see an overlap between the CALM screen DAX as well as the census tracts that are also within the top quartile of extreme heat days. So we see that there are some communities that are DAX but are not going to be the communities where you see the high